I'd just like to take a few minutes to talk to you about what's actually happening within our school district right now. As most of you probably have read or received via SIS messages, we are dealing with various cases of COVID, and it's important for everyone to be on the same page, I think, because there's a lot of terminology that's being used, and sometimes parents get correspondences. We talk about quarantine versus isolation. Let me start there. And so we have a situation, if someone is a positive test, the Department of Health will identify that person will be in isolation. So isolation applies to people with a positive COVID test. However, if someone or an individual is directly exposed to that person will probably likely be in quarantine. So let me put this in a very elementary way. The person with a positive test is the A. A person who has direct and prolonged exposure to person A is person B. So person A is in isolation, person B is in quarantine. And the quarantine is done out of an abundance of caution. That's not to say that the person in B has COVID. It's just to ensure that we have an opportunity, the school district, the health department, you as families, to ensure that that person is healthy. And so the quarantine kicks in, and that quarantine is typically for 14 days. And even during the quarantine phase, we will still provide education to students. And if for staff members, they will still, in many cases, work virtually while in quarantine. So that's two things I want to talk about. But however, how do we get to that point? Another term that we hear about all the time, contact tracing. It's become a very popular term. It's a very involved process, typically taking us hours at a time, working in close collaboration with the Department of Health. And I would like to say kudos to the Saratoga County Public Health Department. The ladies there have been absolutely wonderful to work with. And so just let me give you a scenario. We could get a call at 7 o'clock at night. We convene a group of administrators that we call our COVID response team, and we start gathering information. Everything from seating charts. Where did the kids sit in school? Where did the kids sit in lunch? Where did the kids sit on the buses? Every piece of information to possibly identify the student and other students or staff, if it's a case of an adult, that are around that person. So we go through a very careful analysis of information to try to ensure that, one, we identify the right people, because at the end of the day, this is a public health issue, and we want to make sure that we identify folks who needs to get support can get support, but more important, so we can also stop the potential spread of COVID-19. And so the contact tracing piece becomes an important part of the process. And so we spend a lot of time really trying to investigate and identify who are potentially exposed parties, and then making a very sensible decision in terms of who goes into quarantine and who doesn't. And so sometimes people kind of wonder, like, why did this person get quarantined versus that person? It's because it's about direct and prolonged exposure to someone who tested positive to COVID-19. And it's also, when did a person first show signs of COVID-19? That also impacts who we will determine to be long and direct exposure to that individual. Again, it starts with the Saratoga County Public Health Department. We engage in the conversation with them. We support them with a lot of information because we want to make the best possible decisions. And we know that this is our new reality. We want our schools to be open. So we have done a lot of stuff and will continue to do to mitigate any potential exposure of students while they're in school, any potential exposure of staff while they're working. And so all our protocols still stand. And probably one of the biggest one that we want to emphasize, wearing of masks, hand hygiene, social distancing. And so our students, kudos to our kids. And I've had a tremendous opportunity to go to every building, some cases multiple times during the week. And I see our students in full compliance. I see our adults upholding those things. But I'd like to emphasize for everyone, we need to do it not only in school, but we need to do it at home. The neighborhood parties you can't have kids congregating, even outside athletics where kids aren't following the protocols. I just spent the whole afternoon going team by team, seeing the respective protocols that we're putting in place for our student athletes. So I'm sharing all that with you because we are at a critical junction as we end the first 2 weeks of schools. We've been in school for 2 weeks, and that's a milestone. That's a milestone, and we're taking it day by day, week by week, because our objective is simple: provide the best possible educational opportunities for our students. That's where we start and that's where we end. And in between those two periods, the start and the end, we're trying to do all the things to ensure safety. And that's the reason why I'm talking to you now, so you understand that when we go through a situation that we have a positive case, it's an extensive review of data, and extensive conversations with impacted parties, a lot of interviews completed by the Saratoga Public Health Department, a lot of interviews with students, anyone who could potentially provide information to ensure that we identify the right people to be quarantined and ensure that we have the right information to stop even potential clusters that may be happening within the community otherwise. So this is truly about a collective work and reciprocal responsibility. And what I mean by that is that in order for us to be our best for our students, we need you to also help support that piece of it. It is truly a community thing. And as we deal with COVID-19, it's real. It's real. It's within our communities. However, we will continue to live. We will continue to learn, and we continue to support those things so that we can have a quality experience for ourselves as individuals and a quality learning experience for our students. So I want people to really understand that we're trying to do our very best. And I'm asking you as students, I'm asking you as parents, I'm asking you as staff members, I'm asking you as members of this community, please exercise due diligence, wear your mask, exercise social distancing, wash your hands often. Personally, I have a bottle of hand sanitizer with me at all times. Wash your hands often. And those things, if we do those things, you know what? It mitigates it tremendously. Stop the spread. And hopefully in time, you know what? Our new norm will be a norm without COVID, but a norm that we are much more appreciative of the value that we have for each other and the respect that we have for each other. And that's what it comes down to. Me respecting your health and you respecting mine. So I thank you for what you're doing and what you will do, because Shen, we're in it together. I need everyone to understand and appreciate that as we move forward. So thank you very much.